Hi, I'm Dr. Ron Miller with Pursuit Physiotherapy, and today we're going to go over probably 5 to 6 reasons why you may still be having hip pain after having a total hip replacement. I was talking to a patient earlier about this today. I'm treating him for his knee, and he was like, "Yeah, I have a buddy that has a total hip replacement, and he's 3 months out, and he's still struggling." So, once you think about it, that hip should be replaced, and you shouldn't be having the hip pain from the osteoarthritis. So, what are some reasons why you may still have hip pain after a hip uh, replacement? The first thing is, yes, there could be a prosthesis problem. There are errors that happen. Sometimes the prosthesis was too big or it's not the right size. And sometimes the cement of the prosthesis could not be healing good. Sometimes there could be a structural problem within the hip joint, that prosthesis now, that could be causing the pain. So that's obviously one. Normally your physiotherapist or your person treating should be able to recognize that. Something doesn't feels right. It just doesn't feel right when a physiotherapist is moving it and the end feels. So we should be able to recognize that and send you back to the physician for that one to get reassessed. Now, let's say everything structurally is fine, the prosthesis is fine. Another cause that could be causing hip pain still is there a leg length discrepancy. It's very common, standing and walking, you're getting, you could be walking on a longer or a shorter leg because the leg length now is kind of off. That could be adding into why you're still having some hip pain, especially along the hip and groin area. You could have, number 3 would probably be maybe an iliopsoas or a hip flexor problem. And there's different complications versus an anterior versus posterior approach. But one thing that we do notice is that with anterior approaches, that people may still have a little bit of hip pain because of the hip flexor muscle. And it could even be because of the posterior one also, but it's more common in the anterior. That the hip flexor could be involved a lot, and it's causing more of a hip impingement now, and you're still getting hip pain even though the joint's actually replaced. The fourth thing I would say is probably going to be a lack of range of motion. So even after the hip replacement, you still never regain full range of motion, internal, external rotation, hip flexion, and hip extension. And that lack of range of motion could be adding into why you're still experiencing hip pain, especially in the hip and groin area. But off the top of my head, those are, as I was talking to my patient, these are some of the common things that I see in patients who had a hip replacement and are still having hip pain. So one is going to be a prosthesis problem. 2 could be a true leg length discrepancy now, that the leg is a lot shorter or longer now. 3 could be a hip flexor problem. 4 could be you're still lacking full range of motion that you haven't gotten yet. So if you need help or if you have any questions about this stuff, just put a comment in the comment box below, or you can reach us at pursuittherapy.com and put a little comment in the chat bot, and we can help you out. Thanks for listening.